Good day to everyone. Myself Thirugnanaselvi. I have completed my bachelor degree in nursing and I am working as a nursing tutor in ES College of Nursing under the Department of Community Health. Today I am going to address the topic of newborn assessment. Let's move on to the topic. Introduction. Newborn assessment requires special skills to evaluate a health condition of a newborn. A newborn assessment is a comprehensive head-to-toe physical examination of a newborn that evaluates their overall health, detects potential issues and establishes a baseline for development. Next, we will move on to definition. A newborn assessment is a systematic physical examination of a baby shortly after a birth and within the first 24 hours to evaluate the transition to extrauterine life, check for congenital abnormalities and monitor their overall health. Then, we will move on to objectives. To know infants' state of development and well-being, to detect any deviation from normal, to assess the progress of the child. Then we will move on to the indications. Indications of a newborn assessment includes: first examination should be done in a labor room within 2 hours of birth, and second examinations before discharge. Third examinations can be conducted 6 to 8 week period. Then we will move on to initial assessment, which includes identification. So check and identify the sex of the infant and record with the name, sex and register number. Then identify gestational age, full term, preterm or a postterm babies. Following with identification, we have to check vital signs of a baby, which includes respiration, heart rate and temperature. Respiratory rate should be 40 to 60 breaths per minute and heart rate 120 to 140 beats per minute and temperature 36.5 to 37.5 degrees Celsius. Then we have to check Apgar scoring system. Apgar scoring system is used to evaluate a physical condition of a newborn based on 5 criteria, which includes activity, pulse, grimace, appearance and respiration. So based on this criteria, we will give scoring. So first one is activity. If a newborn has absent activity means we will give 0 point. For a flexed limbs we will give 1 point. If it is active we will give 2 points. And pulse absent 0 point. Less than 100 beats per minute for 1 point. More than 100 beats per minute we will give 2 points. And grimace, if grimace is floppy we will give 0. Minimal response to stimulation 1 score. Prompt response to stimulation 2 score we can give. And appearance, blue or pale we will give 0. Pink body, blue extremities we will give 1 point. Then for a pink we will give 2 points. So at last respiration, if absent we will give 0. Slow and irregular means 1 point. If baby is crying vigorously means we will give 2 points. Next we will move on to history collection. History collection includes entire history of mother and newborn babies, which includes parity, obstetric history, details of antenatal care, other problems of the current pregnancy, maternal illnesses, details of labor and delivery, newborn history, use of sedation or anesthesia, genetic history and significant family history we have to collect. Then we will see physical examination, which includes length. The normal length of a newborn ranges from 47 to 50 centimeter. So crown to heel length with the baby supine position with the knee slightly pressed down to get maximum leg extension. Then head circumferences should be 33 to 35 centimeter. It measured with the measuring tape across the center of the forehead and most prominent portion of the posterior head. Then chest circumferences 30 to 33 centimeter. So it is measured at the level of nipple and about 2 centimeter less than head circumferences. And weight, the normal newborn weight is about 2.5 kg to 3.5 kg. Next is posture, supine position with a partial flexion of arms, legs and hand commonly turned a little to one side. Hip joints are partially abducted in nature. So next is skin. Most newborns have ruddy complexion due to increased concentration of red blood cells and decreased amount of subcutaneous fat. So this ruddiness fades after 1 month period of time. So next we will move on to peripheral cyanosis, which appears due to immature peripheral circulation, and this is normal in the first 24 to 48 hours after birth. And next, central cyanosis, it decreased oxygen, so may cause due to respiratory distress or any other diseases, which indicate central cyanosis. Next we will move on to vernix caseosa. So this is a soft, white, cheesy, yellowish cream on the infant skin at a birth, and it is caused by the secretions of the sebaceous gland of the baby's skin. Then next we have to assess the desquamation. Peeling of the skin takes place few days after a birth and most marked on the hands and feet of the newborn. So next one is lanugo. So this is a long soft growth of fine hair on the infant shoulders, back and forehead. It disappears early in postnatal life. Then we have to assess for the milia. These are tiny sebaceous retention cysts, small white or yellow dots on the nose, forehead and cheeks of the infant. Next, we have to assess the erythema toxicum. It begins as a papule, increasing in severity to become erythema by the second day and then disappearing by fourth day onwards. Then we have to assess the Mongolian spots. These are blue-black coloration of a infant's lower back, buttocks and anterior trunk. They disappear in early childhood period. Then, so next we will move on to head. Newborn head is disproportionately large because it is 1/4 of the total length. So in head we have to assess the fontanelles. The anterior fontanelle is diamond shaped and strongly pulsated. It is normally closes at 9 to 18 months of age. The posterior fontanelle is small, triangular shaped and less pulsatile. It is normally closes at 1.5 to 3 months of age. Next we have to assess the caput succedaneum. It is edematous swelling on the baby's scalp due to infiltration of serous fluid by the pressure. It disappears in few days. Next we have to assess the cephalhematoma. It is collection of blood in between periosteum and flat bone of the skull. So next one is eyes. When newborn cries, tears may not be seen. Lacrimal ducts are not fully matured until 3 months of age. So the next one is ears. The infant's ears tend to be folded and creased. A line drawn through the inner and outer cavity of the eye should comes to the top notch of the ear where it joins the scalp. The infant usually responds to sound at birth. So next we will see the mouth. The infant's lips should be pink and the tongue smooth and symmetrical. Mouth should be observed for cleft lip, cleft palate and tongue tie. Occasionally small round glistering cyst that is known as Epstein pearls are present on a palate due to extra calcium deposited in utero. Next we will assess the neck of a newborn. The neck of newborn is short, often chubby and creased with a skin fold. Head should rotate freely on it. Then we have to check the chest. Chest looks small, possible breast enlargement with a secretion of thin watery fluid that is known as witch milk. Then we have to assess the abdomen. Bowels sound present, edge of the liver palpable 1 to 2 cm below right costal margin. The next one is stomach. The capacity of the infant stomach is about 30 to 60 ml at birth, but it increases rapidly. So next we have to assess the umbilical cord. It has 2 arteries and 1 vein. After clamping it begins to dry and falls after 6 to 10 days. Next we have to assess the back. The spine of newborn typically appears flat in lumbar and sacral areas. So next we have to assess the genital region. Anus must be inspected for a patent and not covered by a membrane. In male baby both testes are present in scrotum. In female labia majora fully covered, labia minora. Then we have to assess for the extremities. Observe for syndactyly or polydactyly. A full-term baby have creases covering the entire sole. So next, we will check the reflexes of a baby. So next we will move on to the reflexes. So first one is blinking and corneal reflexes. So infants blinks at a sudden appearance of light. So the next reflex is pupillary reflex. Pupil constrict when a bright light shines towards it. Then doll's eye reflex. As head moves slightly to left or right, eyes lag behind and do not immediately adjust to new position of a head. Disappears as fixation develops. The next one is sneezing reflex and glabellar reflex. Tapping briskly on the glabella causes eyes to close tightly and disappears as brain get matured. So next we'll see the sucking reflex. Rooting helps the baby to become ready to suck. When the roof of the baby's mouth is touched, the baby will begin to suck. So the next one is rooting reflex. The infant turns his head and opens his mouth to the side when the side of his face is touched. It disappears at 3 to 4 months. And next is gag reflex. Stimulation of posterior pharynx by food, suction or passage of tube causes infant to gog. So next we will see the Moro reflex. The reflex is elicited by sudden dropping of the head in her hand. The baby responds with a series of movements. Tonic neck reflex. This elicited by rotating the infant's head from the midline to one side. The baby should respond by extending the arm on the side to which the head is turned and flexing the opposite arm. The lower extremities responds similarly and it disappears at 7 months. Palmar grasp reflex, which is elicited by examiner placing her finger on the palmar surface of the infant's hand and baby will grasp the finger, which disappears in 2 to 3 months period. So the next one is extrusion reflex. When tongue is touched or depressed, the baby responds by forcing it outwards, and this one disappears by age of 4 to 5 months. Next one is and reflex. Spontaneous response to decreased oxygen by increasing amount of inspired air. So the next one is stepping reflex. Baby makes a movement that resembles stepping, which is disappear in 3 to 4 months period. So next one is Babinski reflex, which is elicited by stimulating the edge of the sole of the feet. The baby will respond by plantar flexion and either flexion or extension of the toes. So at last we have parachute reflex. It is a protective reflex that causes an infant to extend their arms forward with the splayed fingers. Thank you.